If you're doing social distancing properly, and I really hope you are, chances are that one of the only reasons you've left your house is to do groceries. And if you're like me, you're probably also relying more than ever on places like Amazon to deliver stuff to your door. And the pressure on the people who work at these places has never been higher. While a lot of us are being encouraged to stay at home to slow the spread of COVID-19, the people working in our grocery stores, delivering packages, and cleaning our buildings are being seen as essential. And because of that, they've accidentally found themselves on the front lines of this pandemic. Today, I'm talking to my friend Sarah Mujtahedzadeh. She covers labor issues for the Toronto Star, and she's been talking to a lot of these workers about what they're going through and how the companies they work for are dealing with this new normal. I'm Tamara Kandaker, and you're listening to Wait, There's More. Hey, Sarah, thanks so much for doing this.
Hey, no problem.
So I live in a condo and all the packages get delivered to the security desk, and it's a big building, so there's always a mountain of packages from Amazon. And since the start of the pandemic, this pile has looked bigger than ever. So people are obviously staying home and ordering more stuff. And I know you've been reporting on this and talking to people who work for companies like Amazon. So to start off, can you just describe to me, what did this change look like for them at work?
Yeah, so I started hearing probably 2 weeks or so ago now from workers in Amazon's fulfillment centers in the GTA. And what they were really telling me was they were seeing this mounting kind of order volume coming in. They were seeing more workers being hired to deal with the additional orders. They were telling me it basically looked like peak season, which is Christmas time when it's super crazy in there. Things started to escalate as the kind of seriousness of COVID really started to sink in, and we're getting more and more like direction from government to stay at home. Mm-hmm. And so from their perspective, what that was doing was just really increasing the pressure of processing those orders.
What did that pressure look like? Did it mean like working more hours, longer shifts? What did that look like?
Yeah, so basically their managers were offering overtime to basically anyone who's willing to take it. So they're working upwards, more than 50 hours a week to keep up with the volume of orders. Again, hiring more temporary positions. And like from their perspective, the concerns around that were that they're working in facilities where there's sometimes 2,000 people who work there on a regular basis. And the production lines are busy, they're crowded. The lunchrooms are crowded. Their departmental meetings in the morning have hundreds of people sometimes on like a regular day. And so from their perspective, they were scared because the government is saying stay 6 feet away from people. And meanwhile, their production lines are busier than ever and the facilities are bigger than ever.
Right. And social distancing becomes even more difficult as the workplace gets more and more crowded to meet this increased demand.
Yeah, I mean, I think Amazon has now, after we started reporting on this, and not just in Canada, by all accounts, facilities across North America and in Europe, but there were some measures taken to kind of ease the load. So they've now, I guess, spaced out the working stations, so they're only staffed every other working station so they can maintain a bigger distance between them. But at the same time, the people who are like processing the orders are still working in pairs. So social distancing in this kind of environment is really, really difficult to do it completely. From what the workers were telling me, it's just not really possible given the setup of picking up orders and packaging them. You are working in pairs, you're crisscrossing with other people. It's very difficult to fully do that and also like get the work done.
Okay, and what other changes have they made to protect workers and deal with these new pressures that are being placed on them?
So, the big concerns that I'd been hearing were around crowding in the warehouses, the bottlenecks when people were arriving at work. It was really crowded, they were telling me, to get into the warehouse to start their shift. The lunchrooms were crowded. Departmental meetings were still happening. Oh, and another big concern was face masks. People wanted face masks. And they were also really concerned that seasonal staff in particular don't have access to paid sick days. So, there are questions around, are people coming in with symptoms or feeling ill, and what are the risks with that? So what Amazon has done in response to all of that is, first of all, prioritize essential orders. They are sort of trying to limit the non-essential orders that are being put through, although what I'm hearing is on the ground so far, not much has changed in terms of what the workers are seeing. But what the workers are seeing change is kind of greater social distancing measures. So they've allowed people to stagger their start times, either by starting 15 minutes earlier or later, so that those bottlenecks actually getting into the facility aren't happening. They've told people that they can only sit one person per lunchroom table to try and implement some social distancing there. They've canceled the departmental meetings, and they've spaced out the workstations. So every other workstation isn't manned anymore, so there's more space between them. They're also increasing pay for this kind of temporary period where, things are kind of crazy.
We'll continue to do everything we can to keep you healthy, safe, and protected. The work you are doing means everything right now. Thank you.
Added pay is obviously being well received by workers. They're pleased at the social distancing measures. But I think what remains are these problems, which are systemic problems, really, and are being exposed by COVID, but were pre-existing. It is the access to paid sick days. And should you have to choose between losing a day's income and coming into work when you're potentially sick and can potentially infect other people?
We've got people that are still coming to work sick because they can't afford to stay home.
She said, I feel like I have a sore throat. I'm going to go to the urgent care.
April asked us to protect her identity because her daughter, an employee at the same facility, got tested for coronavirus before work today. But she has bills stacking up while she's waiting on those results.
So just to be clear, if an Amazon worker feels sick, how much time can they take off?
So what Amazon has said is that they're encouraging people to use a mix of unpaid and paid leaves if they're feeling sick. So basically what it boils down to is, what are you entitled to as an Amazon warehouse worker? If you're a permanent employee, you do have access to 4 paid sick days, but those are accrued over time and you don't get the full 4 until May. So some people have already used some of their accrued paid sick days, which means they don't have any left, in which case they would have to take an unpaid emergency leave day if they're feeling ill. If you are a temporary worker, you don't have any paid sick days. So a combination of what the Ford government has said around being able to take time off if you're sick and not lose your job is one layer of protection for those workers. And I think Amazon is sort of offering the same guarantee, but it doesn't mean you're going to get paid.
Yeah, so basically, if I'm feeling sick, I have to kind of decide, if I don't have any paid sick time, am I going to go in and risk getting everyone else sick and getting worse, or am I going to stay home and lose that money that I would have earned?
Yeah, that's the decision that's potentially facing a large number of workers in these facilities. Amazon has said that if you are diagnosed with COVID, you will get 2 paid weeks off. So that element is paid. But I think it's the lead up that people are really worried about. And also, if you have been in contact with someone who has traveled, or you think you may have potentially been exposed, but you haven't been diagnosed, what workers were telling me is there's a lot of questions around that as well. Should I not come in? Can I be compensated for that? There's still a lot of outstanding concerns around this kind of gray area before an actual diagnosis.
So in the US, workers are walking off the job because they want access to more paid sick leave. Right now, that's only available to people who've tested positive for the coronavirus or people who get placed on mandatory self-quarantine. And they're also asking for their warehouses to be closed for longer periods of time and more cleaning and guaranteed pay. Is there a push for something like that here right now?
There's a petition circulating right now that was spearheaded by the Warehouse Workers Center in Brampton, which is a new organization that's, really set up because warehousing in particular is quite a precarious job. It's pretty low wage. It's very low unionization rates. And so they are sort of taking this on behalf of Amazon workers. One thing I heard speaking to a number of workers was a real kind of fear of raising these issues with management and a feeling of fear around advocating for oneself in the workplace.
Yeah.
So, right now there's a petition circulating. It's gotten hundreds of signatures. I think that the response from Amazon so far has definitely helped, and, that people are sort of heartened to see that. But I definitely think that the paid sick day issue is something that is really crystallizing as a major issue that I think will continue to be of concern after COVID fears settle down a little bit. We're not seeing, the strikes and more sort of decisive action from workers at this point, but I think it's definitely top of people's mind.
It was reported that workers at 13 Amazon warehouses have tested positive for COVID-19.
But Laura Williamson isn't afraid to speak up because she works there too, and her life might depend on it.
I have lupus. I have a compromised immune system.
She says the company has taken precautions, staggering shifts and breaks, spacing out benches and microwaves, doling out hand sanitizer and social distancing guidelines. But she says they can afford to do much more.
How has the company handled those situations? Do they close the warehouses down, or how do they move forward when someone tests positive at one of these facilities?
The first positive diagnosis in the U.S. was in a New York area warehouse. And my understanding was that they closed down and reopened the next day. And so there were concerns over whether that is the appropriate amount of time to deal with something like that.
In Moreno Valley, Amazon says they're going to great lengths to keep the building clean. The employee diagnosed with COVID-19 is now quarantining at home. And they've asked everyone who was in close contact with that person to self-quarantine too. But Laura says employees are still touching all the same shipping materials, so they're all in close contact.
And I actually think this is a much bigger issue. There's a lot of confusion around what is the evidence-based protocol when you have a positive diagnosis. When you look at other companies like Toyota Cambridge had a positive COVID diagnosis about a week ago, and they've shut down for weeks. Employers are responding very differently. And really what needs to happen is sort of evidence-based government guidelines around what you should do if you're a big employer that's had something like this happen in their workplace. Because right now it seems like it's just up to the individual employer's discretion. I spoke to the federal labor minister last week, and I know that the federal government is working with the provincial labor ministries to kind of provide expert advice on best practices in certain sectors. Right now, they're looking at trucking and food processing to kind of come up with guidelines on how to keep those workplaces safe during COVID. So I think that there's starting to be some movement on that, but they haven't addressed the warehousing sector yet, which really is a huge one. It's so critical for, supply chains and everything.
We'll be right back. I also wanted to talk to you a little bit about cleaners who have also found themselves sort of on the front lines of this pandemic. And you've been talking to cleaners in Toronto too. Tell me a little bit about the conversations you've been having and how their work conditions have changed since all these workplaces started cracking down on COVID.
Yeah, so with cleaners, cleaners long before COVID were probably one of the most precarious jobs in Canada. A lot of cleaners are being misclassified as independent contractors, so they are not entitled to like any protections under employment laws, getting paid minimum wage, if not less, exposed to a lot of dangerous chemicals and not given appropriate training, not given safety equipment. A lot of undocumented workers who really fear speaking up for their rights. And then you throw in COVID, and what we're seeing is a real polarization of workers who are, in some cases, losing their jobs because the office building, everyone is now working from home, so there's no need for cleaners in the building. For cleaners particularly who are undocumented and cannot access the new government funds that have been made available, it is a really terrifying time. Like, I spoke to one worker who just doesn't know how she's going to eat. Like, there's really no support network for these workers. And then on the other end of the spectrum, you have cleaners who their work has just gone into overdrive. They're cleaning these enormous grocery stores, making sure that they're safe for the rest of us to use. And meanwhile, they're being paid less than minimum wage. They're being introduced to new chemicals that they don't know what they are. They're being asked to work overtime and not being paid for it. One woman who I spoke to who is cleaning large downtown grocery stores said she doesn't have a face mask. She has to wash her plastic gloves at the end of each shift because she only gets one pair a week. And what they told me was they're just exhausted and scared by the environment that they find themselves in now, and feel like very little attention has been paid to like a job that is so critical right now.
Do they have to come in? Like, do they want to stay at home? Do they have the option to stay home if they want to?
What I've been told by the cleaners that I've spoken to is that their employer, in some cases, well, first of all, they technically don't have an employer because they've all been misclassified, which again means they have no protection under our labor laws. Do they have the choice? I mean, yeah, they could stay home, but it means they are not going to get paid, and, they could potentially just lose whatever work they had. So the workers who I spoke to said, I have to go in. Like, I don't have a choice. I have to pay my rent. I have to pay my bills.
The last thing I wanted to talk to you about today, and I mean, we could talk about this forever because there's so many different kinds of workers that are being impacted by this, but I wanted to talk to you about grocery store workers because that's also a job that's suddenly become very dangerous. People are washing their groceries before they bring them into the house. So I can't imagine what it's like for people whose job it is to interact with hundreds of customers a day right now and, restock these shelves and how they must be feeling.
What I'm sort of hearing from that sector is, again, these jobs that we are so reliant on right now are some of our lowest wage jobs. At least some retail staff in Ontario do have a union which, provides some layer of protection in some cases. Some of the larger grocery stores have offered, the $2 an hour extra wage boost. But what I'm sort of hearing, both from workers and from members of the public, I have to say, are writing in and saying, I don't think $2 an hour is enough for the risk that's being taken here. A frequent comment that I get from workers and readers is you're seeing retail staff who are often elderly and potentially much more vulnerable to the virus that are still out there working and interacting with the public. You do see some measures being taken, like the plastic screens that we're seeing, but it certainly has not alleviated a lot of the fears around going into work and the feeling that the added protection is sometimes not enough or not proportionate to the risk that's being taken.
And just to go through some of the measures that some of these grocery chains have been taking, they include things like sanitizing carts and baskets, cutting down the hours that these stores are open to allow for more cleaning, installing plexiglass at the registers, like you mentioned. Some stores have put physical distancing markers on the ground to remind people to keep their distance. They're doing crowd control in stores.
You're getting directions where you can go and where you can go. If there's too many people down one aisle, they say, no, you can't go down there right now, wait. They're doing a good job.
But obviously this is not consistent. And what do you think is still missing in terms of protections? Are there specific things that people are saying need to be done right now?
I mean, I think it goes back to like some of the bigger structural issues that pre-existed COVID and will probably continue to exist post-COVID. For workers who are still working at minimum wage, who may not have access to paid sick days, those are kind of like the bigger structural things that determine whether you feel safe saying no to a job that you think is unsafe. Or, saying, no, I'm not going to stock this today because I don't think appropriate cleaning measures have been taken. Or I'm not going to come in today because I feel sick and I don't want to risk infecting others. Really, the answer is probably going to come at a legislative level, sort of mandating that these protections are applied evenly across the sector. Otherwise, again, it's going to depend on the goodwill of individual employers. In terms of health and safety precautions, we do have experience with pandemics. We have experience from SARS. The SARS Commission that looked into Ontario's response to the SARS crisis really identified the Ministry of Labour as being missing in action, as being totally sidelined from the precautions that were taken in workplaces to keep them safe. And that was identified as a huge issue in terms of putting workers and then, by extension, the public at risk. It said in very clear terms that the ministry has to be present in terms of enforcing safety obligations, and that includes protection from illnesses like SARS or COVID and any other kind of viral infection or Legionnaire's disease, anything like that. And I think, what a lot of worker advocates would say is this is a textbook example of why we need proactive, rigorous enforcement from the Ministry of Labour.
Sarah, thanks so much for doing this. We really appreciate it.
No problem.
All right, that's the show. Thanks so much for listening. But before we go, just a quick note that we now have more details on the 75% wage subsidy that Prime Minister Justin Trudeau announced last week. Today, he said any company, regardless of size, including nonprofits, could be eligible for the subsidy.
If your business's revenues have decreased by at least 30% because of COVID-19, you will be eligible for this subsidy. The number of employees you have will not determine whether or not you get this support. It will apply to nonprofit organizations and charities, as well as companies both big and small.
The government will cover up to 75% of your salary up to the first $58,700 that you earn. In other words, up to $847 a week. And this will be backdated to March 15th. And that's all for today. I'm Tamara Kandaker, and I'll talk to you tomorrow.